The countdown is on. In less than 12 hours, the first patients will start moving to the new Helen DeVos Children's Hospital in Grand Rapids. One of the people behind the original hospital is Dr. Bob Connors, president of Helen DeVos Children's Hospital. He joins us live right now from the new location. Thank you for joining us tonight.
Hey, it's my pleasure, Sue.
Well, I'll tell you, you'll start moving the critical care children at 5:30 in the morning, right?
Right around that, yeah, and as you said, it's less than 12 hours away now.
Right. So what kind of atmosphere are you expecting in the hospital tomorrow? How have we planned for this day?
Well, I'm expecting to be very intentional. You know, we've already planned this. We've had run-throughs. I think it's going to be calm and very careful. But we've really been planning this for several years, so it's fun for us to actually have it right on the threshold now of actually happening.
What kind of changes will families and children see in this new home? How can children, heal, I guess, from their perspective? What will they be experiencing in that new hospital?
Well, I think the first thing you'll notice is it's a place just for kids, and I think it's very obvious as soon as you walk in this place. You can see some of it behind me. This is no normal hospital. It's a children's place, and it's really built for families and kids, from the lobby to very spacious rooms that are just set up for kids and families, to all the care, all the technology, all the latest things that we need as caregivers to give those kids the very, very best care available.
So how will this help, I guess, Spectrum in the way that they lead healthcare right now? How do you think that can rank them with other hospitals in the country?
Well, we think that a children's hospital is one of the very important parts of the full spectrum of care here. And I think a lot of people don't realize there are about 5,000 hospitals in the country, but there are only about 200 children's hospitals. So it's really rare to have a children's hospital in a community like this. And we're really proud of the team that we've assembled over the last many, many years to give these kids the best possible care.
Well, it really is a beautiful building. And you mentioned it's been a long process. How long has it taken start to finish?
7 or 8 years, really. When we first started planning this, we engaged families and kids and our staff to really try to make a plan that would build a hospital where we could do the care better. And I think we've really been successful in that. So for all of us that have been involved over those many years, now to just be a few hours from seeing children in this lobby and children in the rooms, it's really quite exciting for everybody here.
Well, congratulations. It is quite a building indeed. Thank you so much for joining us tonight, Dr. Bob Connors. We appreciate your time. And here is a look at exactly how the hospital staff plans on moving patients. It starts bright and early with a final review of current patients at 4 a.m. The pharmacy and respiratory services in the new hospital will be ready at 5 a.m. The pediatric critical care unit will move around 5:30. The emergency department opens at 7, and the first surgery scheduled for 7:30. Pediatric critical care patients will finish moving around 8 a.m., followed by general inpatient floors, and finally, the neonatal move.